Many women think the signs of a heart attack are unmistakable. But the fact is that they can be subtler in women and sometimes harder to recognize. So Dr. Prachi Thanawala is joining us today to break down gender differences in heart attack symptoms. She is a cardiologist at Capitol Health, and we will discuss the most common heart attack symptoms, why women will sometimes experience different symptoms, and why it's important to call 911 if you or a loved one is experiencing a heart attack. This is the Health Headlines podcast series. I'm your host, Caitlin White. So, doctor, what are the most common heart attack symptoms in men and women?
So the most common heart attack symptoms in both men and women are chest pain, shortness of breath, feeling pain in the left arm. Typically, that's what you would experience. People usually describe the chest pain as like a chest pressure. They even say it feels like someone is sitting on their chest.
And what are some of the different symptoms that women may experience that men typically don't?
So I want to point out that the number one symptom of heart attack in women is still chest pain. That being said, women can sometimes experience atypical symptoms. I believe it's about a third of women can experience atypical symptoms. And by atypical, I mean they may have indigestion type symptoms, lightheadedness, palpitations, confusion, or even just feeling more anxious or having a harder time sleeping.
Why do you think that women sometimes experience different symptoms than men?
So no one really knows exactly why women experience different symptoms, but women do tend to have a different distribution of atherosclerotic disease, which is what the leading cause of, heart attack that we traditionally think of. Men tend to have atherosclerosis or plaque buildup in the main coronary arteries, the three main ones that we do think about, but women can sometimes have disease in smaller blood vessels. So I imagine that does contribute to the atypical symptoms that women tend to get.
Is there anything that women specifically can do to, avoid having these symptoms, avoid a heart attack that might be different than what men do?
Absolutely. And actually, 80% of incidents of coronary artery disease and strokes are preventable with just changes in lifestyle and diet, exercise, that kind of thing. So I think knowing your risk factors is the number one thing a woman can do to prevent heart disease. And, of course, the traditional risk factors of diabetes, high blood pressure, high cholesterol, those are obviously important. And in fact, diabetes, it increases the incidence of heart disease 3 times more in women as opposed to just 2 times more in men. And also other risk factors that are specific to women, it's really important to know that as well, because a lot of women just think it's those traditional risk factors when in fact, other risk factors like age, of course, being menopausal or postmenopausal, having polycystic ovarian syndrome, even stress and depression actually affect women's hearts more than it does men. Having your period before the age of 10 or starting after the age of 17, that is actually a risk factor as well. Giving birth before 37 weeks of gestation. And then also having inflammatory diseases such as rheumatoid arthritis or lupus, which occurs in both men and women, but, women tend to actually have a higher incidence of these diseases. So I think that's really important to know. The other thing is that women who have had breast cancer in the past, a lot of chemotherapies and radiation can not only acutely affect the heart, but also long term.
And wrapping up here, just why is it so important to call 911 if you suspect someone is experiencing a heart attack?
It's really important to act fast because time is muscle, and the longer you wait, the more chance there is to, experience an adverse outcome from having a heart attack. And it's always, better to be safe than sorry in my book. So I think that the faster you get help, the sooner we can intervene, and the more chance you have of, coming out of it with a normal heart and less side effects down the line.
Great. Well, doctor, is there anything else you'd like to add just about the gender differences in heart attack symptoms?
I think, the main thing is know your risk factors. I can't emphasize it enough. And then, of course, focusing on things like dietary interventions, which, I can go on for forever, but making sure you're eating a heart-healthy diet, exercising, the recommendation for exercise is getting 150 minutes a week of moderate intensity exercise. And if you're doing high intensity exercise, you can get away with 75 minutes a week. And then also adding 2 sessions of strength training, that is really recommended. So if you're doing all those things, it's great, and you should continue to, because as we get older, our risk factors also tend to grow, and we are at a higher risk of developing heart disease.
Well, thank you so much for joining us today, Doctor. Just some really important information here. We really appreciate your time. If you or a loved one is experiencing signs of a heart attack, call 911 immediately. For more information about Capital Health, heart care specialists, or to make an appointment with Dr. Thanawala, call 609-303-4838. That's 609-303-4838. Or visit capitalheartcare.com. This is the Health Headlines podcast series. I'm Caitlin White. Stay well.